Hello everybody, Shrouded Hand here, and it's time to get demonetized again. Today we're going to take a look at the Women's Medical Society Clinic in Philadelphia, also known as the House of Horrors. Before I start, I just wanted to say, because this is a video about an abortion clinic, I'm just giving details on this particular case. It's not my intention to offer any commentary on the wider issue of abortion rights or anything like that. I just wanted to say that because I feel like some people might try to extrapolate a meaning from it that isn't intended. Okay, so with that being said, let's get on with the video. The Women's Medical Society Clinic was opened in 1972 by a physician named Dr. Kermit Gosnell. Reading about Gosnell's early life, he seems to have been a man who was genuinely interested in providing help to the poor and largely immigrant communities in the West Philadelphia neighborhoods where he grew up. Prior to founding the abortion clinic, he opened a rehab facility and a teen aid program in the same neighborhoods. He was well regarded among his peers and was considered a skilled and conscientious doctor. He opened the Women's Medical Society Clinic with the same intention, to help the poorer communities of West Philadelphia. Now, to understand exactly what went on at the clinic, you have to know a bit about Philadelphia abortion laws, which I've got to admit I'm no expert on this. As far as I can tell, the law was that any woman seeking an abortion had to undergo counselling first that would describe the nature of the procedure. They would also have to wait a minimum of 24 hours after first visiting the clinic before getting a procedure done. Anyone under the age of 18 would need the consent of an adult guardian, and no abortions could be carried out after 24 weeks of pregnancy. Dr. Gosnell's clinic, however, gained a reputation for not really enforcing these rules. Teenagers were admitted without parental approval. Women who were in a hurry were given same-day abortions, and no counselling was provided beforehand. But their biggest reputation was for providing late-term abortions. Despite being completely illegal, he would carry out terminations for women who were well past 24 weeks into their pregnancy. The procedure for these late-stage terminations was simply to give the woman labour-inducing drugs. She would then give birth to a premature baby. On many occasions, these babies would still be alive after being born. The staff would then kill the child by snipping the back of its neck with scissors, severing the spinal cord. None of the women receiving the abortions were told beforehand that this was what would happen. To get away with carrying out such procedures, Dr. Gosnell trained his staff carefully. When doing an ultrasound on these late-stage pregnancies, they were told to hold the ultrasound device at a certain angle to make the fetus appear smaller on the image, thus reducing the chance of prosecution if anyone was to check the records. Exactly why the rules were so lax at the clinic depends on who you ask. People who worked alongside Dr. Gosnell say that they genuinely believed he was trying to help. He thought Philadelphia's abortion laws were oppressive and unnecessary. He wanted to free these women from a life of poverty, raising a child that they didn't want. He knew that they wouldn't get help from anywhere else. On the other hand, his critics saw him as a man motivated by greed, with little concern for the women in his care. The more rules he had to break, the more he could charge. After all, these women were desperate, and he knew they couldn't get help anywhere else. He would charge as much as $3,000 for a late-stage abortion, and he took home over $10,000 a day from the clinic. Despite numerous complaints over the years, very little was done by the local authority. In fact, since 1993, no inspections had been carried out on the facility. Complaints from former patients and other doctors were routinely ignored. This lack of oversight meant that conditions at the clinic just got worse and worse, but nobody outside of the staff and the patients could have imagined how bad it actually was. That is until 2010, when the facility was searched by the FBI. See, not only had Dr. Gosnell been carrying out illegal abortions, but he'd also been getting his patients hooked on opiates. He would generously overprescribe an addictive painkiller called OxyContin. He often allowed unqualified and underage staff members to fill out prescription forms, operating a no questions asked policy for anyone wanting the drug. If they had the money to pay, they got whatever they wanted. Often these tablets would then be sold on the street by drug dealers. This eventually got the attention of the DEA, and after months of investigation, a search warrant was issued and the clinic was raided. What they found inside shocked the investigators. This was meant to be a simple drugs bust, but they found something that they never expected. The following description comes from one of the officers on the scene. There was blood on the floor. A stench of urine filled the air. A flea-infested cat was wandering through the facility, and there were cat feces on the stairs. Semi-conscious women scheduled for abortions were moaning in the waiting room or the recovery room. They were sat on dirty recliners covered with blood-stained blankets. All the women had been sedated by unlicensed staff long before Gosnell arrived at the clinic, and staff members could not accurately state what medications or dosages they had administered to the waiting patients. Many of the medications in inventory were past their expiration dates. Investigators found the clinic grossly unsuitable as a surgical facility. The 2 surgical procedure rooms were filthy and unsanitary. Agent Doherty described them as resembling a bad gas station restroom. Instruments were not sterile. Equipment was rusty and outdated. Oxygen equipment was covered with dust and had not been inspected. The same corroded suction tubing used for abortions was the only tubing available for oral airways if assistance for breathing was needed. There was no functioning resuscitation or even monitoring equipment except for a single blood pressure cuff in the recovery room. The search team discovered fetal remains haphazardly stored throughout the clinic, in bags, milk jugs, orange juice cartons, and even in cat food containers. Some fetal remains were in a refrigerator, others were frozen. Gosnell admitted to Detective Wood that at least 10 to 20% of the fetuses were probably older than 24 weeks in gestation, even though Pennsylvania law prohibits abortions after 24 weeks. In some instances, surgical incisions had been made at the base of the fetal skulls. The investigators found a row of jars containing just the severed feet of fetuses. In the basement, they discovered medical waste piled high. In all, the remains of 45 fetuses were recovered at the clinic that evening and turned over to the Philadelphia medical examiner, who confirmed that at least 2 of them, probably 3, had been viable. Dr. Gosnell was taken in for questioning, along with other staff at the facility. Former patients then came forward with their own horror stories. Over the coming weeks, a terrifying picture of life at the clinic was revealed to the investigators. Each morning, any women undergoing abortions were lined up in a filthy waiting room and given medication that induced painful contractions. Sometimes they'd be left for hours unattended and writhing in agony. Eventually, when the time was right, they'd be taken to the bathroom and made to squat over a toilet and expel the fetus into the bowl. The staff would fish the fetus out of the bowl afterwards to stop it getting clogged up. The amount of pain experienced by each woman depended on how much money she was willing to pay. Dr. Gosnell had a price list for different levels of sedation. The poorer you were, the more painful the ordeal. All the medication was administered by unqualified and poorly trained staff. This sometimes had deadly consequences. When 41-year-old refugee Karna Maya Mungar attended the clinic, she couldn't even read the form she was made to fill out. She was then given high-dose IV injections of a dangerous sedative called Demerol. After a few hours, the staff happened to notice Miss Mungar wasn't breathing. Exactly how long she'd been like this, nobody could say. They attempted CPR, but by that point she was completely brain dead. Paramedics were called in and she was taken to hospital and put on life support, but as there was no brain activity, her life support was switched off the next day and she was declared dead. The crime went under the radar because staff had lied about who had administered the sedatives and how much they'd given her. Sometimes Dr. Gosnell needed to carry out a more complicated abortion than the usual induced labour. For this he would need to extract the fetus manually. Medical equipment wouldn't be sterilised properly between operations, meaning that venereal and sexually transmitted diseases would often spread between patients. Dr. Gosnell had a habit of botching these procedures, leaving women with internal wounds that would become infected. In one case, a woman's cervix and colon were perforated during an unsuccessful abortion. Afterwards, she was left untreated for hours in a dirty recovery room. When her relatives came to pick her up, they were initially refused entry. When they were eventually allowed in, they found her bleeding and unconscious. She was rushed to hospital and had to have part of her intestines removed. On another occasion, after receiving an abortion, a woman was sent home with parts of the fetus still inside her uterus. Over the following days, the fetal remains started to decay inside her body. This caused a massive infection. She was nearly dead by the time she got to hospital, but thankfully they were able to save her. In another incident, a 19-year-old woman had her uterus pierced during a botched procedure. She was held bleeding in the clinic for hours until she fell into shock from the blood loss. Only then was she taken to hospital, and they had to give her a hysterectomy to save her life. There was also secret procedures that Dr. Gosnell only performed on a Sunday. No staff were allowed to be present during these operations except for his wife. These were abortions provided to women who were very near to giving birth, 8 months pregnant or more. Nobody except Dr. Gosnell and his wife know what went on during these procedures. They must have been considered too disturbing for the other staff to witness. Given the horrific nature of the terminations they were carrying out throughout the rest of the week, it's hard to imagine how much worse these Sunday operations were. Behind the scenes, the conditions were even more disgusting than the investigators first realised. The filthy waiting areas and operating rooms might have been the cleanest part of the clinic. Fetus parts were packed into old shoeboxes and whatever other containers they had lying around, then crammed into a freezer. Often the freezer got full, and so it wasn't uncommon to find containers full of fetal remains lying around on whatever surfaces were available. A disposal company was supposed to come and collect this waste, but Dr. Gosnell would usually forget to pay the disposal fees, and so the waste would just lie around, decaying for weeks on end. At certain times they would try and get rid of the excess fetus remains by cramming them into the waste disposal pipe. This caused the pipe to get clogged up. On one particularly grim occasion, they used a plunger to unblock the disposal pipe and a baby's leg came out. I mentioned briefly the investigators found several jars of feet on a shelf. This is one of the strangest details because nobody really knows why Dr. Gosnell was collecting these feet. He said that it was in case anybody needed the DNA for a paternity test in the future. Medical experts were called in to verify this explanation, but they said that only a small sample of tissue should usually be kept. None of them had ever heard of a whole foot being kept for this purpose. It seemed like Dr. Gosnell just liked collecting feet for some reason. Another thing he collected was pictures of women's genitals. Before performing a procedure, he would photograph their private parts, telling them that it was for his research. As far as anyone could tell, he wasn't conducting any research. He was just taking these pictures for his own amusement. There's many more things in the court documents that I could mention. It would take all day to list them, and some of it is just too graphic to put in a YouTube video. I'll put a link to the grand jury report in the description. You can go read it if you want. Some of the testimonies in there are stomach churning. In the end, Dr. Gosnell, his wife, and 7 other staff members from the clinic were put on trial. The most serious charges against Gosnell was the 3rd-degree murder of Connor Meyer Mongar and 4 first-degree murder charges for the slaughter of live babies. There was also multiple charges for performing illegal late-term abortions, failing to follow procedures, and for racketeering. Kermit Gosnell was sentenced to 3 life sentences for his crimes. The other staff members received different sentences depending on their level of involvement. 3 of them were charged with 3rd-degree murder and got between 5 and 12 years in prison each. The others were charged with either performing illegal abortions or just for being part of a criminal organisation. A lot of them got reduced sentences for agreeing to testify against Dr. Gosnell. In the end, he was only convicted of 5 actual murders, but this is only because there wasn't enough evidence to convict Dr. Gosnell of any of the other killings. According to testimonies from staff members, he'd murdered hundreds of viable babies after they were born. This would actually make him one of the worst serial killers in American history. I'm not really sure why I cover topics like this. I noticed a few of the stories I've covered over the last year or so involved weird medical stuff or pregnancy or some sort of genital mutilation. Probably because of my own medical history, having testicle cancer and going through different surgeries and various fertility-related medical things. I don't really think about that when I'm picking these stories. I just choose things that I found the most horrifying, but I imagine there's some kind of subconscious reason why certain topics resonate more deeply with me than others. I don't know. Anyway, thanks to everyone supporting the channel on Patreon. It does help me out a lot. I know I say that all the time, but it is true, so thanks to all of you. You are keeping the channel going. I really appreciate it. So here's some more videos you might like. Do people actually click these things at the end? I don't think I've ever clicked one, but someone must do, right? If not, then I'll probably pop up in your recommended in the next few days, so look out for that and I'll see you there. Okay, until next time, goodbye.